Stop what you're doing for the next 30 seconds and glance down at your feet, because what I am about to share with you could be the crucial factor that helps you detect a life-threatening illness early, while your body is still offering quiet, subtle whispers. Or it could be the warning you overlook, only to discover the truth 5 years from now when those whispers have turned into desperate, unmistakable shouts. Let me introduce you to a patient I'll call Walter. He was a 71-year-old retired plumber from Ohio who came into my office last spring for a standard cardiology checkup. On the surface, he felt perfectly fine. There was no chest discomfort, no breathing difficulties, and his energy levels were reasonably good. It was right at the very end of the appointment, almost as a casual aside, that his wife mentioned his feet had been feeling a bit numb for the past year or so. Walter chuckled and brushed it off, saying it was just a normal part of aging, but something about that comment made me pause and decide to investigate further. We ran one additional blood test that very afternoon. The results revealed his fasting glucose had skyrocketed to 218, and his hemoglobin A1C was sitting at a dangerous 9.2. Walter had been living with full-blown diabetes for at least 2 years, completely unaware of his condition. Why? Because no one had ever taken the time to explain to him the silent messages his feet were desperately trying to send. I'm Dr. Alan Mandell. I'm a heart surgeon, and for the last 2 decades, I've dedicated my career to operating on hearts, witnessing firsthand what happens to the bodies of seniors when minor, subtle issues are neglected for far too long. Here is a truth that almost no one outside the medical field ever articulates clearly. Diabetes is not merely a disease of sugar. At its core, it is a vascular disease, an affliction of your blood vessels. The vessels that succumb to damage first are the ones situated farthest from your heart, the longest delivery route in your entire body, which is your feet. Today, I am going to guide you through 9 distinct warning signals that manifest on your feet long before any standard blood test can detect a problem. You might have already been experiencing some of these for months. You might have dismissed others as simple consequences of growing older. I urge you to stay with me through all 9 because sign number 5 is the one that almost nobody ever links to diabetes, and sign number 9 is the easiest to observe, sitting right in plain sight every single day, yet it is the most frequently overlooked. Let's get started. Sign number 1. Persistent tingling or numbness in your feet. Now, practically everyone has experienced this sensation at some point. You sit with your legs crossed for an extended period, your foot falls asleep, and when you stand up, you're greeted by that familiar pins and needles feeling. That is a perfectly normal occurrence. What I want you to pay attention to is whether this is happening to you regularly and without any clear, logical reason. Whether you're sitting at the breakfast table, lying in bed at night, or simply walking to the mailbox, if your feet are tingling on their own erratic schedule, your nerves are actively communicating with you. When your blood sugar remains excessively high for a prolonged period, the surplus glucose acts like a slow-acting corrosive acid, gradually eating away at the protective coating that encases your nerves. Think of your nerves as electrical wires. The plastic insulation is what ensures the signal remains clear and accurate. If you strip away that insulation, the wire will still function, but the signals will become fuzzy and distorted. That very fuzziness is precisely what the tingling sensation represents. The American Diabetes Association estimates that nearly half of all individuals with diabetes will eventually develop this type of nerve damage, which is medically termed peripheral neuropathy. Critically, it almost always initiates its assault in the feet. My professional advice is to make it a priority to take a 20-minute walk every single day if you are physically able to do so. This doesn't have to be a jog. A simple, steady walk is sufficient. Additionally, begin reducing your intake of added sugars starting today. Not next month, not next week, but right now, today. Sign number 2. A burning sensation in the soles of your feet, especially at night. This particular symptom is incredibly deceptive because it often doesn't bother you during the day when your mind is occupied with other things. Instead, it strikes at 11 p.m. when you are lying in bed, the room is silent, and you have nothing to focus on except the intense heat radiating from the bottoms of your feet. My patients describe this feeling in various ways. Some say it feels like they've walked across a scorching hot beach, while others describe it as a slow, dull burn that simply refuses to subside. Whenever I hear a senior patient mention this symptom, my ears perk up immediately. This is because burning feet at night is one of the classic textbook early indicators of diabetic neuropathy. The nerves in your feet have sustained damage, and as a result, they are now misfiring, sending erroneous heat signals to your brain even when nothing hot is actually touching your skin. To visualize this, think of it like a fire alarm that has a broken sensor. The building isn't on fire, but the alarm is shrieking because the sensor itself is faulty. A study published in the journal Diabetes Care revealed that this type of burning pain frequently manifests itself anywhere from 1 to 3 years prior to a formal diagnosis of diabetes. 1 to 3 years. That is the immense amount of advanced warning your body is generously providing you. The solution here involves a two-pronged approach. Firstly, ensure you are drinking at least 8 glasses of plain water each and every day. Secondly, incorporate a source of fiber into every single meal you consume. Think vegetables, oats, and beans. Fiber plays a vital role in slowing down the rate at which sugar enters your bloodstream, which in turn gives those damaged nerves a much-needed chance to recover. Sign number 3. Cuts and small wounds that stubbornly refuse to close. This is the point where diabetes transitions from being an uncomfortable condition to becoming an actively dangerous one. Patients frequently walk into the emergency room and say something like, "Doctor, I developed this tiny blister from my new shoes about 3 weeks ago, and it's still an open wound. I just assumed it would heal on its own." And you know what? In a healthy body, it absolutely should have healed. A minor cut typically closes up within 5 to 7 days in a person with normal bodily functions. However, when your blood sugar is consistently high, the microscopic blood vessels in your feet become stiff and constricted. The white blood cells, oxygen, and essential nutrients that are responsible for closing wounds simply cannot reach the affected area quickly enough to do their job. Imagine trying to water a garden with a kinked garden hose. The water is there, but it's just not reaching the soil where it's needed most. Here is a truly chilling statistic from the Centers for Disease Control and Prevention. Diabetic foot ulcers are the leading cause of non-traumatic leg amputations in the United States, accounting for over 100,000 amputations every single year. And nearly every single one of those cases began as a small, seemingly insignificant wound that was carelessly ignored. Tonight, after you finish your shower, I want you to sit down in good lighting and carefully examine both of your feet. Look between your toes, check underneath your heels, and inspect every surface. If you spot any cut, blister, or open sore, gently clean it with mild soap and water, apply a basic antibiotic ointment, and cover it with a clean bandage. And crucially, if it hasn't shown significant signs of improvement within 48 hours, you need to call your doctor. Not next week, but within that 48-hour window. Sign number 4. Darkening or discoloration of the skin on your lower legs and feet. This particular warning sign hides in plain sight, often going unnoticed for a long time. You might glance down at your ankles in the shower and notice that they appear a little darker, a bit reddish, or almost look bruised, even when you haven't bumped them against anything. You might rationalize it by telling yourself, "I've always had slightly dark skin around my ankles." Sometimes that is true, but there is a specific pattern of discoloration that physicians are specifically trained to identify, and it has a clinical name: diabetic dermopathy. When the small blood vessels in your lower legs are damaged by sustained high blood sugar levels, The skin in that region doesn't receive an adequate supply of fresh, oxygenated blood. Over an extended period, the skin's color begins to change. You might observe darkening, a reddish-brown stain, or even patches that appear slightly bluish in hue. The skin may also become thinner and more fragile, making it easier to bruise. A study featured in the Journal of the American Academy of Dermatology found that these skin changes are detectable, on average, a full 18 months before a formal diabetes diagnosis is ever made. 18 months of warning, literally written on your skin. My daily recommendation for you is to dedicate 5 minutes each morning, before you even put your feet on the floor, to performing some gentle exercises. Do ankle circles, toe raises, and gentle calf stretches. Even this small amount of movement is highly beneficial because it helps push fresh, oxygenated blood into your lower legs. Now, before we proceed any further, let me ask you a direct question. Have you noticed even one of these first 4 signs in yourself or in someone you deeply care about? If your answer is yes, I would like you to type the word "yes" in the comments section below. Just the single word "yes." I make it a point to read every single comment on this channel, and I genuinely want to know what you are observing in your own body. And while you are there, please take a moment to hit the like button. It signals to YouTube that this video is important and helps show it to more seniors who are in desperate need of seeing this information. Sign number 5. Heels that crack and split open and refuse to heal no matter how much lotion you apply. This is the sign that astonishes my patients more than any other. I fully understand that cracked heels are a common issue among older adults. However, when your heels are cracking deeply in the middle of July and your lotion seems completely ineffective no matter how much you slather on, that paints an entirely different clinical picture. Diabetes attacks a special group of nerves called the autonomic nerves. These are the nerves responsible for controlling automatic bodily functions that you never consciously think about, including the sweat glands in your feet that naturally keep the skin moist from the inside. When those nerves are compromised by chronically high blood sugar, the moisture pump effectively shuts off. No amount of topical lotion can fix the underlying source of the problem. Furthermore, those cracks in the skin of your feet are not just a cosmetic nuisance, they are wide open doors for dangerous bacteria. In a foot that already suffers from poor circulation, a bacterial infection can escalate from a minor issue to a serious, limb-threatening condition in a matter of days, not weeks. The American Podiatric Medical Association has identified chronic, treatment-resistant heel cracking as a meaningful and significant indicator of autonomic neuropathy in senior patients. My nightly advice is to thoroughly moisturize your feet every single night before you go to bed. Coconut oil works wonderfully for this, but any high-quality moisturizing lotion will suffice. Apply it generously to the soles and heels, but be very careful to never apply it between your toes. Trapped moisture in those tight spaces creates a perfect breeding ground for fungus. And don't forget to drink your water. Your skin desperately needs hydration coming from the inside, just as much as it needs it from the outside. Sign number 6. Persistent swelling in your feet and ankles. Now, a certain degree of swelling is perfectly normal. If you've been on your feet all day at a family wedding, or you've just endured a long-haul flight, your ankles might puff up a little bit. That type of swelling typically resolves overnight with rest. What I'm describing here is something distinctly different. I'm talking about swelling that is consistently present every single evening. Swelling that leaves deep pronounced sock marks indented in your skin. Swelling that stubbornly refuses to go down even by the next morning. When high blood sugar levels inflict damage on your kidneys, and diabetes is the leading cause of kidney disease in this country, your body's intricate fluid regulation system gets thrown completely out of balance. Excess fluid then pools downward, driven by gravity, and settles in the lowest parts of your body, your ankles and feet. A simple test you can do at home is to press your finger firmly into a swollen area of your ankle. Hold it there for about 5 seconds and then release. If the indentation from your finger remains visible in the skin for several seconds before slowly bouncing back, that is medically termed pitting edema, and it is a legitimate clinical sign that warrants a conversation with your doctor. The National Kidney Foundation reports that diabetic kidney disease affects roughly 1 in 3 adults with diabetes, and swelling in the lower legs is frequently the very first visible signal that kidney function is starting to decline. The advice here is straightforward and actionable. Elevate your feet for 15 minutes, several times throughout the day, especially in the evening hours. Even resting them a few inches higher on a simple pillow is often enough to help drain excess fluid back towards your heart. Also, make it a habit to read the sodium labels on everything you eat. Salt causes your body to retain water, and the vast majority of processed foods are absolutely loaded with it. Sign number 7. Sharp, stabbing, or electric shock-like pain in your feet, particularly at night. This is the symptom that I see misdiagnosed more frequently than any other. Men, in particular, often come into my office and tell me, "Doc, I've been taking ibuprofen for foot pain for the past 6 months. I just assumed it was arthritis or an old sports injury." And sometimes that diagnosis is exactly right, but in other cases, the pain has absolutely nothing to do with arthritis whatsoever. When nerves are damaged by high blood sugar, they don't always simply go quiet. Sometimes they react in the complete opposite direction. They become hyperactive and oversensitive. They start randomly firing intense, agonizing pain signals up to your brain, even when there is no actual physical injury. Patients often characterize this pain as a sudden stab, a searing hot needle, or an electric shock that seemingly comes out of nowhere. It tends to happen most frequently at night, when you are lying still and your brain isn't distracted by daytime activities. Ibuprofen and other over-the-counter pain relievers may temporarily mask this pain for a few hours, but they do absolutely nothing to fix the underlying nerve damage. Even worse, taking ibuprofen on a daily basis over the long term carries its own significant health risks. It can elevate your blood pressure, harm your kidneys, and, as a heart surgeon, I will tell you plainly, it also increases your risk of a heart attack. A study published in the New England Journal of Medicine found that this kind of painful diabetic neuropathy affects approximately a quarter of people with diabetes, and it is frequently mistaken for arthritis for years before anyone ever thinks to test their blood sugar. My morning recommendation is to dedicate 5 minutes, before you even stand up, to performing gentle foot stretches while still in bed. Flex your feet up and down, circle your ankles, and gently pull your toes back. The goal is to get your circulation moving before you place your full body weight on your feet for the day. Sign number 8. Cold feet that remain persistently cold, no matter what you do. We all experience cold feet from time to time. Cold floors, cold winter weather. That's just a normal part of life. What I want you to pay attention to is whether your feet are cold in the middle of July, cold even when they are tucked under 3 heavy blankets, or cold while the rest of your body feels perfectly warm and comfortable. That changes the entire diagnostic picture. As a heart surgeon, this is the sign that lights up my brain like a bright flare, because persistently cold feet that simply refuse to warm up are one of the clearest and most reliable signs of peripheral artery disease. Your blood vessels have narrowed, often as a direct result of long-term, elevated blood sugar, and warm, nutrient-rich blood simply isn't reaching the extreme ends of your feet in sufficient volume. To visualize this, picture your circulation like the heating system in a large house. When the pipes narrow, the radiator in the back bedroom stays cold, no matter how hard the furnace works. The American Heart Association estimates that more than 8 million Americans are living with peripheral artery disease, and diabetes is the single largest risk factor for developing it. Cold, pale feet are among its very earliest and most telling signs. The single most effective thing you can do here is to incorporate a brisk 30-minute walk into your daily routine. This is not a leisurely stroll. It should be a purposeful, arm-swinging, pace-quickening walk. If 30 minutes seems too daunting, start with just 10 minutes. The essential point is that you are forcing your blood to actively push into your lower legs, strengthening the vessel walls, and over time, you can even partially reverse some of the early narrowing that has occurred. And finally, sign number 9. This is the one that almost nobody ever talks about. In my entire career, I have never once had a patient bring this particular symptom up on their own. It's only when I visually examine their lower legs during a routine physical that I notice it. Then, they look down and usually say with surprise, "Huh, I never noticed that before." I want you to look at the skin on your lower legs and the tops of your feet. Now compare it to the hair on your thighs. Is the hair on your lower legs significantly thinner than it is on your thighs, or has it completely disappeared? Hair follicles are tiny, but they are incredibly demanding. They require a steady, uninterrupted supply of blood and oxygen to continue growing normally. When the circulation to your lower legs has been progressively compromised by years of elevated blood sugar, the hair follicles slowly stop receiving the essential nutrients they need, and as a result, the hair simply stops growing. The noticeable absence of hair on your lower legs is a quiet, yet highly visible marker of blood vessel damage that has been quietly occurring beneath the skin's surface for years. Published research in the journal Diabetes, Obesity, and Metabolism has confirmed that hair loss in the lower extremities correlates strongly and reliably with peripheral vascular disease in diabetic patients. It is a well-established physical sign that vascular doctors are specifically trained to check for during their examinations. Right after you finish watching this video, I want you to look down at your own lower legs and feet. If you notice that the hair is significantly thinner or completely absent, please make it a priority to schedule a simple fasting glucose blood test this week. Not this month, but this very week. This test costs about $12 at any standard medical laboratory, and it is typically covered by Medicare for most of you. A $12 investment and one simple blood draw can completely change the entire trajectory of your future health. So let me bring all of this vital information together. 9 critical signs that your feet are using to communicate with you. Tingling and numbness, a burning sensation at night, cuts and wounds that won't heal, skin discoloration on your lower legs, heels that crack relentlessly, no matter what, persistent, pitting swelling, sharp, stabbing, nighttime pain, cold feet that refuse to warm up, and hair loss on your lower legs. Each one of these individual signs represents your body's sophisticated early warning system, desperately asking for your help and attention, often years before any standard blood test would ever catch the problem. Here is what I want you to do tonight, just one single thing. Sit down somewhere with good, bright lighting, take off your socks, and spend just 30 seconds looking at both of your feet. Look closely between the toes, examine the heels, run your fingertip gently along the skin to check for any areas of numbness, and carefully inspect the color of your ankles. If you see or feel even just one of the 9 warning signs we have just thoroughly covered, please call your doctor tomorrow morning and specifically ask for a fasting glucose and a hemoglobin A1C blood test. The earlier this condition is detected, the more completely and effectively it can be managed, typically with a combination of dietary changes, daily physical movement, and an open, honest conversation with your physician. You have worked far too hard for the life you have built, your precious independence, your energy, and your ability to do the things you genuinely love. Don't let a highly manageable condition like elevated blood sugar take any of that away from you. Just because nobody ever told you what you should be looking for. But now,